Item number 1, receive update from the Coronavirus Relief Fund Task Force. Here to make that presentation is Marshall J. Brooks on behalf of the Coronavirus Relief Fund Task Force. I'll say at the outset, no decisions are requested of the court today, but he's going to give you an interim brief of kind of where we are and try to get some direction on a few things that we want to get some direction from the court, just as a consensus. But again, no final decisions. We'll be back hopefully near the first part of July with some more specific requests for action. We do have one action item following item number 1 that relates to this, but I'll let Marshall Brooks talk a little bit about that. Commissioner Ward, would you grab the lights real quick?
Morning, Judge, Commissioners. Appreciate this opportunity to brief you on what the task force has been working on. Before we get started, I'd like to go over, you're all aware, but I just want to go back over a brief background on the Coronavirus Relief Fund. That 20% allocation has been received by Smith County. That 25% will have to be used up, or excuse me, 20% will be used up front. Then the 80% that's remaining would be a reimbursement based on expenditures. The CRF requires that any expenditures that are incurred are due to the public health emergency that's ongoing. Expenditures must be reasonably necessary according to this court's judgment. Items may not be currently budgeted for, and costs must be incurred between March 1st of 2020 and December 30th of 2020. The funds may not be used to offset revenue losses due to the economic situation. Texas's total allocation was $11.24 billion. Cities and counties with a population of over 500,000 received approximately $3.2 billion directly from the Treasury. Of the remaining allocation to Texas, $1.85 was allocated to all the other local governments. It's based on a $55 per capita that came from the state. Money that's not used reverts back to the state on December 31st of 2020. Texas placed special requirements on their allocations to local government that requires a 25-75 split in their expenditures. And I'd like to read this. This is directly from the state's grant book. The subrecipient agrees that a minimum of 75% of its allocation will be spent in the categories of medical expenses, public health expenses, and payroll expenses for employees substantially dedicated to mitigating or responding to the public emergency. Now, why is this important to us? Is because as we go forward, everyone needs to understand that in order for us to spend the money, 75% must be allocated to this, 25% would be to the remaining. That would be things like IT equipment and whatnot that we've had to for work from home, just as an example. And so to spend 25, you have to spend a corresponding 75. It's not that you can only spend up to 25%. There must also be a corresponding 75% tied to that 25% expenditure. Is everyone clear on that? Okay. All right, so far, work to date, we've met weekly since our inception. We solicited input from elected officials and department heads on their needs in dealing with this particular virus. The fund has been established to track the COVID-19 and the related expenses. The spreadsheet budget has been started and is in progress. We're looking at it daily and it's being updated daily. We've worked with vendors to get pricing for budgetary purposes. And today we're holding this presentation to you, the court, to solicit ideas, input, and receive guidance. So far to date, we have purchased in the county personal protective equipment. That's for various offices, elections, it's for courts, it's for the jail, the sheriff's office, first responders, my office, the fire marshal's office, so that we can keep everyone safe in dealing with the public and we can get back to business at hand. Sanitation supplies to keep our facilities clean due to the sanitation, or due to the COVID-19. There's situations that have arisen where we may have someone who has tested positive, and so we've had to have extraordinary sanitation measures put in place. Office disinfecting contractors that have also been used in cases specifically in our situation with the jail. We've also utilized this fund to date. We ordered 400 COVID-19 tests from a lab, and these were high turnaround labs tests that were used so that we could get a better account of what actually the situation is in the jail. That was completed, last week, Sheriff? Okay. We've also ordered 70 touch freestanding sanitizing stands. Those are to be used during elections so that we can make sure that the public has the opportunity to sanitize their hands before and after they vote. We've also purchased 2 walk-through metal detectors, 8 handheld metal detectors, and I'll mention what those are for here shortly. And we're also able to recapture some IT expenditures that are related to remote workers for Smith County so that we could continue operations safely. At one point, we did send some folks home, and so that did have a kind of an extraordinary burden on the IT staff, and so they did have to purchase some equipment for that. And also, we've made several IT upgrades to the courthouse so that we could continue the hearings that needed to be continued. And then today, before the court, we're asking for an X-ray scanner, and again, I will discuss that here shortly, what that's for. That's actually like a bag scanner, for instance, like what you have out in front of the courthouse and also here at the annex to scan the bags that are coming through. Some future purchases that we're looking at are thermal temperature scanners. Now, these particular scanners are, think of it as a closed-circuit TV, except when a person walks through, it puts a box around their face because it's also checking their temperature. And what this is done for is to mass scan the public as they're coming in, and employees as they're coming in, to identify those that are needed to be checked or verified. So in other words, if their temperature range is out of threshold, this particular system, without having to personally touch and interact and scan each individual, which puts the public at risk and it also puts our employees at risk, this allows us to single out those that are above the threshold as far as temperature is concerned, and that'll keep the lines moving quickly. We're also looking at audio-visual upgrades. The equipment that's in this room is antiquated, and so for us to continue to have the ability for the public to virtually participate in court, we're looking at some upgrades because we don't know how long this particular situation is going to go on. And so, as you can see, a lot of our equipment is in here on a temporary basis. This would be a more permanent solution for that. Some other items that we're considering is the consultant, and that there is 2 large jurisdictions in the state of Texas that have already hired a particular consultant. We're looking at what's available to us, and they're there to help us make sure that we're spending the money correctly, that we're fulfilling all the government requirements, and so that we will lessen our chance of having any of this money recaptured at a later date. And we're also looking at our FLET lab. There's some major upgrades that could occur. Again, looking at this from a long-term perspective, that is our public health laboratory here in East Texas. And so any upgrades that we can make will actually benefit the community because it will allow for future testing as needed. We're looking at rental of alternate sites. Now, this is where all of the X-ray scanners, and this is where the metal detectors come in, because we're looking at alternate site for jury selection. Our current site for jury selection is very small, and therefore we cannot assure proper social distancing and the safety of the general public that are coming in for jury selection. And so as we look for these alternate sites, we still must provide security for those in the room and also the court staff that are going to be over there and the judges. And so we're needing this equipment so that we can have it available at this remote site to screen as the potential jurors are coming through. Oh, excuse me, one more. And we've also, one of the things that we're looking at, this was actually kind of a secondary item, but I think it's something that we really need to consider, is we're looking at a potential of a rapid response trailer. So if we have a breakout, say at a food processing facility or some other just critical infrastructure, this would be a trailer that could be used for mobile testing. It could be used for PPE distribution. That we could set up and again to try to mitigate any damages related to this virus. And so with that, I'll conclude and just kind of open it up to any comments, questions, ideas, or guidance that this court would have for us.
And Marshall, if you go back a couple of slides, let's go back to that one right there. And I'm just going to add some commentary for a couple of these slides real quick. So the purchases you see to date, those are what I would term kind of no-brainers, things that needed to happen immediately to get geared up for elections, get geared up for off-site jury selection in in July, and just general stuff around the county that was already being purchased and tracked under COVID-19 tracking guidelines through the auditor's office. But because we had a new source of revenue for that, or a new source of money for that, we began to purchase those, like, for instance, the personal protective equipment out of those funds. Now let's move to the next one. These next couple of ones are the ones that really require the court's input and we need direction on. We're going to get to item number 2 here in a second, the X-ray scanner, which is, as the marshal pointed out, kind of a part of a package of equipment needs for doing off-site jury selection. And then these future purchases of potential purchases of the thermal scanners, and then these the consultant. Go ahead and move on to the consultant. The FLET lab, these items right here, if we can stay on this particular slide, we really do, from the task force, need to get a little direction from the court about whether or not you want us to even pursue some of these directions and bring you back more specifics. All of these items that you see on this screen would need court approval through our purchasing guidelines. They're not small items, they're large items. So we would definitely bring those back, but before we even get to that point and go down that road of getting quotes and getting things filled out, we want to get a little direction from you today. So that's a little bit more context of what we're asking of you today. Are there comments or questions for Mr. Brooks or for Marshall Brooks generally, and then let's come back to these items.
I have a question about the thermal scanners and the thermometers and all. Is there a statute anywhere, I don't know if this is be for Thomas or you, that the state or county or federal has that will reject somebody from coming into a building that has a temperature? I mean, to me, I mean, you can't just say, no, you ain't going to come in here because you got a temperature. Now, is there a law, a statute, or something that is said that you know, that we can hold people to that?
The county does have the authority to restrict access if they believe that the individual poses a health and safety risk. As far as a specific statute, that would fall under, likely fall under, I believe, the emergency authorities that the state, the legislature has granted the county judge. Now, with that respect, we would also have to understand that we are going to continue to allow public access to our building to utilize those public resources that we have available, like the clerk's office and the law library and access to the courts. So we have to balance that as a body. But there is authority for the county to restrict access based on public health and safety. And so what we would do is, if I can get you some more specific guidelines on that as well.
Yeah, and we can talk about that more in executive session. It's a good question, and the balancing policy is we certainly don't want to prohibit people from accessing, but we don't want to expose them, especially in a juror situation. You know, we could easily reset somebody to come back and do jury duty. Those kind of situations, we could provide alternate means to access items in the law library, which we're already doing, but that's a good question. We need to make sure that we balance those interests because we want to provide access to county government to folks.
And the judges have been very understanding. They have been very accommodating with the Zoom hearings, and they understand, and we had this discussion before this all started about what would happen if somebody did have a hearing and they had a high temperature, and the judges all understand that if somebody comes in with a high temperature and we have to say, hey, you need to go get checked out, or you need to go talk to your doctor, your temperature, or whatever, at that point, the judges will reset that case, and they will not penalize anybody for missing a court date for that reason.
Yeah, and that came down actually originally as part of the suggested restrictions from the OCA, the Office of Court Administration, which were ultimately adopted by the local judges in their plan for resuming in-person hearings.
Jay, thank you for your work you've done over the last few months. I don't have any problem with these. I do have some of the same concerns I've already voiced, so I would like more information that's come back. And on the potential of a consultant, I think that's probably almost like our health insurance consultant, probably good money to be spent. to make sure if there's things out there that we're not thinking about that other entities have already done. I don't really have a problem. I'd like the information on what the cost would be and how that's paid for and things like that ahead of time. And the trailers, as this hopefully is over soon, that's something that it could be converted or changed into maybe something with a long use, not just for this incident. So that's my only questions or comments.
Commissioners, if I may go back to the cameras for just 1 second, because I do have some comments that I would like to add, because I'm very concerned about HIPAA, and I'm also concerned about privacy. And so I want to assure that in the specifications that we're out looking for vendors on this particular item, there is a facial recognition that is done, but it's only done to identify the face so that it can be scanned. There's no storage of any facial recognition. I want the public to understand that we're not storing any facial, and quite frankly, we're not storing any of this data, because if you store temperature, it is HIPAA information, and we're not going to be responsible for HIPAA information. So this is not going to be recorded. That's again, and it's also not going to identify the specific temperature. It's just going to say whether it's in a threshold, and if it's outside that threshold, then it would be up to normal procedures or developed procedures on how we want to further scan that individual to decide what to do.
And what about the contact tracing as well? I know there's a lot of concern, and I have that concern as well of what we're doing with this contact tracing information that we're paying for through this.
The contact tracing information is not shared. Again, it's shared generally. That is maintained solely within the Net Health Department. That information is used just to identify those that may have come in and been exposed, and to try to notify them so that they can seek medical attention if they need to. We're still trying to develop that program. The state's working on developing a program. And again, what we're doing here seems to have been working, and it's very private for our citizens. And as of right now, I believe the plan is we're going to continue that program. I don't know that we've adopted what the
Yeah, and let
state
me add to that. We're not participating in the state program, by the way. I know there's a lot of concern with the statewide program that was put out to bid and then awarded to a company out of Dallas and from an out-of-state central location. But that's not what we're doing. We're handling all of our contact tracing locally, as we've been doing from the start. So we're not part of the state program at this point.
And Judge and Commissioners, Chapter 81 of the Health and Safety Code does provide that the local health authority has the authority to do the contact tracing. They are bound by the same HIPAA laws that the county is bound to, that all of other physicians and medical providers are bound to. So they take extra steps to safeguard our protected information, and so they have that obligation under their statutory authority.
Do you know of any what their record retention is? Because to me, after just couple of months, that could be thrown away or whatever, or tore up or whatever.
There are record retention schedules for local health authorities. I would have to research that and get that information to you. I don't know that off the top of my head.
But it's not. I think the main point here, though, is, Commissioner Phillips, it's not deviating. There's no deviation at this point from the local health authority that we're aware of, and we've asked these questions in our joint EOC that they're not doing anything different currently with that protected information as a result of the contact tracing. It's still being protected at a very high level here locally. And that's why we want to control it locally. That's why we don't want to participate in the state's program.
And I just, if there's anything that ever comes from the state and everything, I want to make sure you make this court aware of it. So
Yes, sir. Absolutely.
I got a question. I was over to Cotton Belt yesterday and got the thermal deal. So are we turning people down if they got any kind of temperature, or they're making them walk out over there?
Yeah, I bet they are.
There's rules in place for
So
judicial
are we assuming
proceedings.
that everybody's got a temperature
No.
got covoid?
I'm sorry, what was it?
Are we assuming that anybody's got a temperature has covoid?
Well, we kind of have to assume that at this point, just because of and the thing about that is, when you look at this particular virus, it is a novel virus, which means that no one has antibodies and no one has even the capability of having a vaccine at this point. And so you're having to weigh rights versus public. We said that from the beginning, is that because of a person that enters, there is no way for the other people that are in that building to protect themselves. There's no way. And so, again, there is a threshold, and I believe it's been 100.4. So it's not like you have a low-grade fever, you're going to be kicked out. There is a threshold that is, at this point, you are infectious, and that's from medical doctors. That is from their consensus. That's not something that we arbitrarily made up. We're taking data from medical experts for this. And so what we're trying to do is just protect not only our staff, but also the public, because this virus is absolutely, there's no if you come in contact, the likelihood of you getting this virus are pretty high. And some people it's a very easy virus to get over, and for some it's deadly. And so we can't, it's mitigating a risk is what we're trying to do, and we're trying to preserve the rights of the public at the same time. It's a very difficult position, for sure.
So if you're over 100.4, then that's when we would reject you. If anything below that, you can come in. That's good to know.
Okay,
That's good.
the sheriff's office has been responsible for doing that, and so that 100, it is 100.4. Yes, sir. Okay, 100.4. Yes, sir. So we're not talking about like I said, a low grade. This is obviously some type of infection in the individual, and because we're not medical doctors, we just have to at this point assume.
Well, and those, I heard on the news this morning, and what you hear on the news is, you can probably take with a grain of salt, but 30% of the people where you talking about it's bad is people that have diabetes or or some kind of heart disease, and those kind of three major diseases. I forgot what they are, is when they really affect them most serious. But of course it can affect anybody, but that's who needs to be concerned. And if you have those type things, then you need to take personal responsibility and watch what you're doing, where you're going, and all those kind of things.
Yeah, these are very tough discussions because we want to have certainly openness to the public. But I'll tell you, one of the legal issues that was talked about early on when restrictions started coming back down from the Office of Court Administration to the judges about how they had to handle court proceedings was that they frankly, the Office of Court Administration and those at the state level could not guarantee judges judicial immunity if somebody attended a hearing and got COVID as a result of that. That's a really big deal. That's a big liability that the legislature probably needs to address if that is an open question. That is the reason why we actually have to take reasonable measures to make sure that we are being cautious in not presenting a situation where we are the cause of somebody coming into contact with COVID knowingly, but we got to do that reasonably so that we don't restrict access to government. We're doing the best we can in that balance, and we'll continue to do that. I'd be curious, Sheriff, let's just let's have some conversations about whether or not we really are seeing a high rejection rate of any individuals coming into the building. I'd be curious if we even rejected any. I don't know. So that might be a point of discussion for us at some point. But these are very good questions, and I hope the public realizes we're kind of caught between dealing with state mandates and the health and safety of individuals and openness of government.
Well, businesses are looking at the same thing, like what you said, of the liability, and so that's a lot of their concern. So this is something that the legislators need to look at, I think, on a federal level, and maybe have some kind of immunity there for whatever, because, who can control, as far as I'm concerned, a God thing, he's the only one that determines, if somebody's going to get it or not, but.
Any other questions for Marshall Brooks on the presentation? Thoughts also, I'll come back to what Commissioner War said, the consultant. Let me give you some idea, and I want to get some feedback. We're aware that some of these consulting agreements out there with other counties and other cities and entities could reach upwards of $250,000. That's about 5% of what we've been allocated, and that's a pretty big matzo ball right there. So give me some feedback about what your level or threshold of willingness would be to go down that track. If it was 50,000, 100,000, 150, where's your level of comfort in hiring a consultant to make sure that this money gets administered correctly. Because it's a lot of administrative burden on the task force and those that are involved. It's been a lot of work, actually.
Are they basing the fees on what they're giving the county, or these consultants, or how does that?
And in part, it's I know some of the consultants out there do it as a strict percent of how much money comes through. Some do it based on a flat fee. We've seen different models that have been presented, but I just want to give you kind of a number to think about, that some of those numbers are upwards of that amount of money.
Obviously, y'all have already done a lot of the work, so I would like to start with that already excluded from anything that they have, and other than that, I'd like to look at their fee structures based on what they bring in help us, I guess, to secure and follow the guidelines and track that from that point forward.
Yeah, very well. Yeah, we'll go through that process and bring you back some exact numbers and proposals.
The fee structures.
Yeah, so you guys can see the exact numbers on what companies propose for us specifically here in Smith County. To know that you're open to the idea of a consultant is really what we needed to know today. The second one is the FLET lab upgrades. This is both, before we get numbers again, this would be something to come back to the court, but looking at potentially trying to assist with upgrades in equipment and restructuring their lab physically so that they could have the ability to run more tests more quickly. Of course, the lab was not set up even to do COVID until this thing hit. They redid the lab so that it could do COVID, but the capacity for doing tests is very small. So they need additional equipment and additional lab space, and to tie into the physical main facility out where it's located in order to run these tests more effectively without stopping. Do you guys see a benefit in going that direction?
Is this the Northeast
Public Health
Lab? So when you say
Public Health Lab, I'm sorry, I apologize. I should have spelled this out. Public Health Lab of East Texas is the official name.
Is that
of
it
FLET.
there?
It's
in the
connected
building
with
on
So
Broadway?
it's
yeah.
there. Did they not get any money at all to this?
Not that I'm
COVID
aware
relief?
of as of yet. Now, I'm sure there will probably be made some through the local health authorities and things like, but I don't directly to the Public Health Lab, none that I'm aware of.
They have not. Yes, that's correct.
And Judge, I would say, hopefully we won't in our lifetime see anything totally random that makes jumps like this one has, from mammal to human species mammal. But it's very likely could happen again at some point. But the antibody testing and things like that, if this would help them do that, because as soon as this is over in a year, we're going to have a lot of people that want the testing, see if they've already gotten it, if there is some immunities built into their system now, and also to make the vaccines if they do need previous positive people that may not know it. If we've got such a large percentage of people that are asymptomatic, we very likely, some of us may be walking around, had already been exposed but never had the symptoms. So I don't have a problem with that one, really. It's all, if the money's coming to Smith County, we're basically building it and helping it for Smith County and our region. So.
And Judge and Commissioners, the Department of Treasury has put out some guidelines that provide that these funds can be used to transfer to other local governmental entities as long as it's not used to offset shortfalls that are budgeted for. So this is something that nobody anticipated, nobody budgeted for this type of expense. So this would be an eligible expense to use the coronavirus funds.
I would just want to make sure that all of our needs were taken care of, that we can pay for the things that we need to pay for in the county here before we move on to that level. Now, if this is just a little extra money that, we're going to have this, we're not going to spend it over here, and I could see the need for that, but I want to make sure our needs are taken care of here first.
Yeah, and that's right on target. In fact, this helps us do that because to Marshall's point earlier about the 75-25% split, we've been trying to brainstorm about how to get more things in the 75% category because honestly, the state's given such a limited, narrow use of that 75%, it's going to squeeze our ability to be able to use the 25% bucket of funds. This particular project goes in that 75% bucket, which is why we're bringing it to the court, because it'll actually open up the ability to do more stuff like IT stuff for our county that might not otherwise be able to be done because of the 25-75 split rule.
And if this, I know this will come back and everything, but just so y'all can be looking into these things, but when you look into it, I mean, to me, I'm not seeing kind of like Commissioner Ward talked about, not some rinky-dink thing that's going to do a couple of little old tests and a day or whatever it needs to be. The real deal that's going to last us and really work for us, you know.
Correct, and anything that would be put into the FLET lab, I mean, this equipment is not just COVID. So in other words, if we had a flu outbreak in a couple of years that we didn't have a vaccine for, which has happened, I mean, the H1N1 scare that we had several years ago, these machines are set up so that they can run viral tests. It's not just COVID related. However, in this particular case, we do need it for COVID. So the current capacity of the FLET lab is about 50 tests per day, and that's working literally with their machines working all day. And so the equipment that we're talking about would expand that to 200 overnight.
So,
Oh, go ahead.
one quick question after Commissioner Ward.
Jay, something that, because we get this questions when we're out in the public or speaking to small groups or whatever the case may be, you know, we'll see numbers go up and then numbers go down, but it doesn't seem to be tied to the percentage of tests being ran. And I would pass that on to George, that it can be alarming if people say, oh my gosh, we've had 25 tests, but we ran 300% more tests the week before. You know, it's not a true apples to apples comparison. And I think that's a real disfavor they're doing themselves, because it makes people that are already suspicious, such as myself, on some of the reporting, that if we're not reporting it tied to the percentage of tests, then it's really no reason to report that number.
Huge number.
I agree with you, and that's the reason why, as far as the executive team that's meeting, we're really watching our hospital.
Right.
We're really watching the hospitals, because we know the fact of the matter is, if you have not had the virus, and we really don't know even if you've had it, the likelihood of you getting it are pretty good. We are also seeing, you know, a lot of people that are asymptomatic with this particular virus, and so we're really kind of watching under the advice of medical direction. We're really watching the hospitals. That's how we're kind of trying to gauge, because we know that there will be more positives. It's going to occur until we have a vaccine or we develop herd immunity. To develop herd immunity, according to the experts, we're looking at 60 to 70% of infection rate throughout the general public. So obviously, we hope we get to a vaccine long before that.
And my other comment, and then I'll be quiet, is to the general public and anybody watching that might communicate to your state officials and representatives that the restrictions they're putting on local county government where the rubber meets the road is ridiculous. I think they would scream to the clouds if the federal government puts the same restrictions on them, that the federal money will return back to the Treasury if they don't spend it as appropriate as the guidelines that the state has put on us. So I would just echo that if it's going to be the way they're pushing it down to us, they need to follow that same guidelines.
My other question, before the train left the track a while ago, the personnel that it takes to run this lab, do they have that personnel, and we are not going to be required to provide any extra personnel or anything like that?
No, sir, because the equipment actually can handle the throughput of the test. It's the same personnel. It's just the machine itself has a greater throughput, I guess is the way I should put that. So no, they wouldn't need any additional personnel from us. They have not requested that either.
What are the questions from the court on these matters? This is good input. Thank you. All right. Hearing none, I think we have some pretty good direction on those items that are on the board that we need to get some direction from you on. And we'll get additional questions answered through some follow-up, maybe through executive session on the legal issues that were addressed today. But thank you for that input. If you have further input, feel free to see the marshal.
Thank you for your time.
That's all we need on item number 1. Item number 2, consider and take necessary action to approve a discretionary purchasing exemption and order in accordance with Texas Local Government Code Section 262.024 for Smith Detection for the purchase of an X-ray inspection system resulting from the COVID-19 pandemic, and authorize the county judge to sign all related documentation. I'm going to ask Mr. Wilson to make comment about this here in a second, or Sheriff Smith. This, if you want to add to what I'm going to say, this is solely for the purpose of doing off-site jury selection. We know we're going to have to do that at some point, and we're going to have the grand jury selection. We've got it set and scheduled July 16th, and that's going to go on. but we need a way to get security to pass through, because any of the facilities that we're going to use, and in particular the first facility we're going to use over at the Rose Garden Center, does not have that security on it, which is why we need the magnetometers and this X-ray machine to make sure that we run them through normal security. Gives us an opportunity to do a test run in July and then see how that's going to work out for jury selection off-site beginning in August, which we're still working on the details of that, and we'll bring that back to the court at some point. Questions?
My question is, I mean, I don't have a problem with this machine or whatever, as long as it's a good one like what we have. I know Sheriff bought the best the last time. It works really well, top of the line. If there's anything newer out there, at least the same. But is there a place to store this over there? And if not, is this machine going to be, I mean, because they're sensitive, and I know you don't want to be moving them back and forth. So I have a question about that and what we can do about that.
Well, I think the short answer on that is yes, we're going to find a place to store it securely, and we don't want to move it from location to location. I agree with you, which is why we're trying to find a location from August until November that will take care of our jury selection, so we're not moving site to site, site to site, which would be logistically a nightmare for everybody involved. We really want one site that can accommodate us through the fall, and we're still working on that. But yes, and it's a great machine. This is another reason why we wanted to get this machine is, frankly, we can do it under the auspices of the COVID-19 issue and have a great machine that can also be used for our facilities here normally once this is all done.
Backup or whatever.
That's what was my question. I thought we could rent it and send it back after this kind of blowed up. So we'll keep the machine, is what you're saying. Okay.
We will absolutely keep the machine. Yeah.
All right.
And
Did Caldwell work out?
We're still working on that. Yeah, still working on it.
And just for the record, Judge and Commissioners, we do, this is for public health and safety, so it does qualify for the bidding exemption. I've spoken with Ms. Haney over in purchasing, and to get this bid out and to get it done in a timely fashion, even with the time crunch that we're under, we would not be able to meet our July deadline for picking a grand jury. We have to pick a grand jury. If we don't pick a grand jury, quite frankly, justice slows down in the criminal process, and we cannot have that happen. So we are moving forward with that, and that is kind of the reason we are moving forward with the designation of the purchasing exemption. Also, there was some previous discussion in the last time we purchased these items about using the older items that we kept for a backup, such as situations like this. It turns out that we actually can't use those items. They will not work properly. And so in order to move forward, we have to have these new ones. So that's why you have the discretionary exemption order, and this is a direct response to the COVID-19 outbreak.
Sheriff, you have anything to add to any of that?
What Thomas stated is exactly correct. There's a reason we replaced those other machines, and to ensure the safety and security of the facility, the potential jurors and the court, it's necessary to have an X-ray machine. Well, otherwise, we'd have to go through each individual bag, and that's not a good situation.
Okay, other questions for the sheriff? If not, is there a motion to approve a discretionary purchasing exemption and order in accordance with Texas Local Government Code Section 262.024 for Smith Detection to authorize the purchase of an X-ray inspection system resulting from the COVID-19 pandemic and authorize the county judge to sign all related documentation?
Second.
Motion by Commissioner Nix, second by Commissioner Phillips. Any further discussion? All in favor say aye. Aye. Any opposed? Item 2 passes unanimously.